Wear glasses?
This is the Egyptian way. One day we catch with technology, and we have a better speaker.
So be sure not to let this one touch.
Okay. Okay. Can you hear me now? Okay. We have a big lecture tonight, and I just wanted you to. I'm surprised that so many people came, because when I decided to put the title for the lecture, tell Joyce about it, I said this title is so difficult, but it is the core of disease, and I don't know if I can change it. So and I had to put it scientific terminology as it is. Are you following me or no? Yes. So the word inflammation, that was a title in a medical magazine I'm reading, and that was the title I was interested in. And of course I know about aging. I've been working for a long time in medicine. However, anything can make it easy for me as a physician, I appreciate it. Anything can make me answer my patient question, I would appreciate it. Anything can hold back aging process, I would appreciate it. Are you following me or no? I think every physician in the world, even the crooks, they love to see their patients get better. I think so, because I think the finest group of people I ever met in my life are physicians. Even we disagree, we don't have that evilness inside us against each other. We disagree because we're ignorant about something, but not intentional. Are you following me? So if you ever have a discussion with your physician or something, it's ignorant and fear of lawsuits. Because whatever he say, if it's not published by FDA approved, he can be sued. And a lawyer will take him to take everything he got. Illinois right now have lost 25% of their physicians in the last 5 years. 25% of doctors in Illinois moved to Wisconsin or other states or quit. I have a physician just joined my practice, and he came to me because he had chest pain, and he thought maybe he's having a heart attack. And I asked him, what do you do? He said, I'm a board-certified neurologist, and I'm board-certified surgeon, and I'm board-certified internist, like me also. I said, wow, you're a board-certified, you're a very good scientist. How old are you? He said, 34. I said, how long have you been in practice? He said, 1 year. I say, what are you quitting for? He said, stress. I have a chest pain from stress because every time I examine a patient, I have only 5 minutes to finish the exam before somebody knocks on the door that next patient is ready. He works for a company paying him close to $500,000 a year. And he liked it because he had lots of loans. And then when he paid off the loans, he started thinking about his own life. He said, I'm quitting medicine. I said, you don't have to quit. You can join me in the practice. He said, no, not this nutrition and preventive stuff. I don't believe in that. I said, well, why don't you just become a consultant for me, discuss with my patient headaches, numbness, tingling, their eyes. You're a professor in your field. Come here. Whatever the insurance pay, you take, rather than quit. He's 34, and I'm 62. So there is a big difference, 30-year difference. I got to teach him. And then he saw my patient one after other, talk to them. He start falling in love with preventive medicine. Even he's getting maybe $2,000 a month, maximum. That's what he get. That's $24,000 a year from $500,000. So most of physicians are ignorant about it. I wanted to talk to you tonight about this process of aging, and I have reviewed all the literature about it available, and then the part of the lecture today, we're going to talk about specific things about aging and how to counter it with nutrition. Then next lecture, it will be continuation to this lecture, and the one after that and the one after, they're all going to be the new modern medicine. How nutrition is taking a leap forward, tremendous leap forward in science, and nobody is bringing nutrition in science at all, none except maybe about 30 or 40 physicians in the whole country. And those physicians are professors in universities. They're not interested to see patients, and they're not interested to be consultants for any company. They just want to say vitamins are good, vitamin C, vitamin B, vitamin D, whatever, and they want to stop right there. So I will discuss with you one of them also from Harvard University tonight. If we look at the picture of disease that we are facing, we find out that from the 1900 to 2004, heart disease is going up with the population. Cancer is going up. Hardening of the arteries is going up. When you have hardening of the arteries, what do you get with it? High blood pressure is going up. What else you get with it? Aneurysm is going up. And strokes with it going up. You follow me? They're all related to each other. And you go on, diabetes, this, Alzheimer, you go on and on and on. And since 1970 until now, it's still going up. And we don't have an answer. Then we discovered certain things. We looked to make a diagnosis for disease. Patients come to us and say, I have a headache, or I'm tired, or I have aches, or I'm dizzy, I don't feel good. These all symptoms, the patient tells the doctor, this is my symptoms. If we go back to the history of diagnosis 5,000 years ago, Chinese start using different techniques to make a diagnosis. They start, making screen of the body and this point, which was great that time, and they use herbal medicine to counter it, which they have great success. India did the same thing. Egypt did the same thing. Ancient Egyptians I'm talking about. Then comes the 18th century. The 18th century, when the church broke with the political system in Europe, I'm sure you know what separation church from the government, that produced a new generation of people called the scientists. Those scientists, they try to make a diagnosis. Some of them use a urine. No, before the urine, they use the palm of the hands. Start looking at the palm, and they said, okay, we see something yellow, we see the nail doesn't look right, the eyes doesn't look right, then we must have a problem here, a problem there. And they treated people, and people felt better, and some of them did not. Then, after that, it came the analytical chemistry. The chemical analyzers were developed. That means you can take a urine, and you can take a blood and screen the people out. And we discover diabetes, we discover cholesterol, we discover hormones, we discover lots of things that can go wrong in the blood, and we started treating it. Some of us treat it with nutrition, and some of us treat it with drugs only, and some of us, like me, treat it with both, nutrition and drugs, if we have to. So my experience with you tonight is that 25 years I have practicing the combination of nutrition and medicine together. And we have probably the most successful results. The diagnosis in medicine was depend on certain things, and then after that, in chemistry, and urine was checked also, like the word diabetes, mellitus. The word mellitus means what? Means honey. So the doctor who discovered the diabetes, he called it diabetes mellitus, means honey urine. Because he used to taste his patient urine and see which one is urine sweet, and he will prescribe to them certain herbs and sort of chromium and zinc and this and this and this, and put them away from sugar, and that's how he treated diabetes. That is a physician sacrificed his own life probably for us, the diabetic now. Are you following me? This is human being. Human beings are beautiful. They will do everything to help others, but in the meantime, they do everything to kill each other. You know, they have both characteristics, the good and the evil. They have both of them, and they can choose their way. Then we had the most recently, CAT scan, X-rays came on, CAT scan came, MRI scan came, and nuclear scan came out, and we were able to look inside the body without cutting the body. And then we start seeing things inside the body that is scary. Start seeing cancers, we start tumors, blocked arteries, atrophy, the brain is shrinking, blood in the brain is shifting, the heart is this, the heart is large, the heart is small. We start seeing things we don't like. But we didn't know how to approach it, because the approach, the make sense approach, it did not occur to doctors all over the world. The common approach would have been one of three things could be causing the disease. Let me make them four. Okay. One of four things could be causing the disease in my patient. Could it be genetic? Could it be nutrition? Could it be stress? Could it be chemicals that we put in the environment? Does it make sense to you or not? If you're the doctor, I'm the patient, come to you with a problem, wouldn't you ask me how are your parents? Wouldn't you ask me what kind of food I eat, what kind of diet, what kind of drinks, do I drink water or beer? Wouldn't you say, do you eat lots of fat or this or olive oil? Wouldn't you say, if you have a brain, of course you will have to ask me these questions. If you don't have a brain, then I don't blame you. You don't have to ask any questions. Then we should also ask the person, how much stress do you have in your family, in your job, in your environment in this life? It doesn't mean we're going to change the environment. We're not going to replace his wife and his kids and his job. No, we're going to make him tolerate the stress better than somebody else. Are you following me or no? We will use meditation. We will use exercise. We will use believe in God. We will use nutrition, calcium. We will use everything we can to calm him down rather than give him drugs. But that also was not considered. Until 1990, the medical literature said stress has no role in causing disease. That was medical books then. Now it's saying different. It says apparently stress could cause disease. That's apparently, but it's not for sure. And chemicals even took a worse dive. Wouldn't you ask me if I live in Los Angeles or Chicago or Minnesota or Sheboygan, wouldn't you ask me if I drink water from Mississippi River or Lake Michigan or the hose with lead in it, leaded pipes? Wouldn't you ask me if I eat canned food and do that or eat fresh food, organic? If you don't want to ask me those questions because you don't have a brain, I don't blame you. Because if you don't have it, then you shouldn't ask it. So, but the chemicals also, these are the three things I can change. I cannot change this here. But I could have changed three of them right here. This is how I started practicing my medicine against all the killer diseases, you name them. I have a whole list of them right here, but you Alzheimer, diabetes, heart disease, stroke, cancer, I see all of them because I treat all kinds of patients except children. I don't treat the children because it's better to be treated by a pediatrician because it's closer to them and I don't want their headache anyway. But I will tell the mother what to do for them, but I don't want to see them. But if they come to my clinic, I be nice and gentle and take their blood and not hurt them very much and make a balloon for them and then let them go home. And don't charge them either. So in any way, when I started practicing, some of you know me for many years. When I started practicing medicine, and you know in those days the only thing I know of is Shaklee vitamins versus others. And the only thing I know of is let's talk about the protein, the Shaklee protein. Let us talk about what kind of carbohydrate. Let us talk about what kind of fat. Let us talk about what kind of vitamins. Let us talk about what kind of water. Let's talk about what kind of minerals. Let us talk about what kind of fibers and so on. Then we know this is nutrition. And then each one will start saying, okay, well, let's change this and this and this and this, and people start getting better. But do I know why they get better? No. I remember 1980, I believe 1982, where I was the head of cardiology in a hospital. And a patient called me from Green Bay, Wisconsin, that she is about, I think was about 28 or 29 that time. And she said she's going blind. And she's seen an ophthalmologist and nobody can help her. And she heard me in a lecture in Green Bay and she thought I might be able to produce miracles for her. So I told her, only person who produces miracles is God, not me. But if you want to come, I try anything on you. I only gonna try nutrition. Put her in the hospital for 2 weeks, give her massive amount of mega vitamin therapy, ankylation, and this and this and this and this, detoxification process, and build her up or that. Within a week, her vision was getting better and better. In 2 weeks, she was normal. And I'm not an ophthalmologist. I don't even know how to check my own eyes. Then I send her back to her ophthalmologist in Green Bay. He said, no, go back to him, whatever he did, continue to do the same thing. She still sees me until now, and we discovered later on she had macular degeneration, but it wasn't discovered. She had MS, was not discovered. Autoimmune disease was not discovered, and we treat her with IVs and Shaklee vitamins until now. And until now, she's still working, and she's fine. So she asked me, what did you do? I said, I have no idea. All I did, change your diet, better protein, better carbohydrate, better fat, better vitamins, better minerals, better water, better fibers, better exercise, and that's all I did. And give the confidence to God to let him heal you, because to take that part away from her, because she was not sleeping. So I give her things, calcium and things like that, to make her sleep longer hours. And detoxification, we use EDTA, chelation, to remove lead and mercury and things like that. But if you ask me pinpoint, what did I do? I don't know. All I know, the patient doing better, but I don't know why. Then the insurance company and the licensing board and Medicare got together, and they came to the office and they said, what are you doing here? We heard you doing something different than we taught you in medical school. Well, I was a graduate from Rush. I work in the Navy. I work at the VA. I said, I'm not doing anything different. I'm doing nutrition. Don't do that. I'm giving vitamins. Don't do that. I said, I'm going to do that. I will do it. Even if you cancel my license, it doesn't mean I'm going to stop practicing medicine. I'm just going to hire another doctor with a license and tell him what to do. So don't be smart at the board that was sitting in front of me, and God gave me that power that I have no fear. I told him, I left Egypt for freedom to this country, and you're not going to take it from me. And that's the way this country built on. I didn't know the free speech and all that. My lawyer later told me they were wrong, but I didn't know that. As you know, some of you know that I was even arrested in Richland Center, Wisconsin, 1972, for saying that chemicals in the food can be harmful to our children, and fat in milk can clog arteries, and vitamin can be helpful. 3 things I said, I was arrested for it, but I didn't know it was wrong what they did until they later on erased the record completely that I never was arrested. When I went to the immigration to get my citizenship, the judge asked, have you been arrested? And you have to answer. I said, yes. He looked again, he said, no, you haven't. I said, yes, I have. So in my pocket, I have the arrest record. I know, because my friends, the Americans that time, who knows the law, they said they did against you was wrong. So I said, maybe when I get my citizenship, I told the judge that. Then I brought it to him, I showed it to him. And he said, oh, those bastards, you know, they even erased it from your record. You are a good citizen, go. I remember those words. So in any way, now we discovered new ways that we can predict a disease 10 years ahead, 15 years ahead, blood test, that we have proteins in the blood. We can do analyze, and Medicare pays for it, and insurance pays for it, because they don't know what it is. Like when I tell you the names of it, they don't know what it is, they pay for it. But because those tests are so expensive, they still pay for it. And I said to myself, gosh, if all these things in the blood, what happen if I start doing it? So I started doing those tests, and then I found out that those chemicals in the blood causes inflammation. They are causing fire inside the body. Those chemicals is produced by the body, for the body, but against the body. Let me give you an example. If you have a bee sting in your hand, naturally it's going to swell. Then the swelling will go away after about a day or two, and things will go to normal, right? But some people will have a bee sting, and they cannot breathe after that. They have a full anaphylactic reaction. Right or wrong? Why? You step on a piece of glass, it swells, then you treat it. Somebody else steps on a piece of glass, then he have anaphylactic reaction. So we start realizing the human cell, when it was produced the first time inside the mother when she was pregnant, this is a pregnant mother, or this is a pregnant mother, either way you want it, that's fine. This baby inside here, this baby here, let us say this is the first baby on earth. Cable or Habel, the sons of Eve. Let's say one of them. She was pregnant in one of them. Then who created this person? Who made him? God made him, right? That's natural. Adam and Eve, they had sex, and then they had a baby. And in the environment they were living in, whatever it is in this world, in this earth, it was not in the moon, was not in Mars. We keep going to Mars to try to look for people, and we have not even discovered our own planet. Then we find out that those days were not peaceful days for them. There was volcanoes, there were radiations, there was lots of things in the environment that can cause disease, no genetic, because genetic code is perfect, right? Right or wrong? Genetics has to be perfect. Then we don't include it here. We just say they had to deal with nutrition, to eat. They have to deal with stress, to run in front of dinosaurs. And then they have to deal with toxicity, whatever the volcano sulfur dioxide is going to produce in the environment. But the baby was born perfect. What happened? We discover that this baby is protected by many layers. One, in the skin of the mother, that she have beta carotene, that protect her against radiation. Then inside, another layer, the uterus wall, is full of vitamin E. Then we have another layer inside, which is the liquid around the baby, which is full of B complex and other lecithin and other vitamins. Then the baby himself. And he himself or she herself also have layers of the same thing. And goes down, down, down to the cell itself of the baby. And the cell of the baby will look like this. It has a nucleus, and he's born or she's born, and he needs to grow up. So he needs the protein, the carbohydrate, the fat, the vitamins, the water, the mineral, and the fibers, and everything he needs from outside. And he didn't have heart disease, he didn't have cancer, he didn't have MS, he didn't have lupus, he didn't have any of these diseases. So why? Because that baby eating things that's natural from the environment, the air itself is, the water is clean, the mineral is there, everything was there, the fiber was there, so the life itself was a better life. And this baby will grow. And then let us compare this baby to nowadays babies. The babies these days will be like this. This is a baby right here with arms like that. And then grow to older baby, which is 50 years old. And then grow to a much older baby, whatever, we just make him bigger. So this growing process required more protein, more carbohydrate, more this, more that, and then we notice there is disease developing. In studying the cell itself, we will look at the cell, and we will look at that's what a human cell will look like. It's very complicated, it has lots of highways, lots of streets, and it has 1 million reaction enzyme per second. And if you take the tip of your hair, just one piece of the hair, and put it under the microscope, it will have 100,000 of those cells. So the cell is very busy all the time, your cell right now, and you're getting older the moment you are born. Why were you getting older the moment you're born? Because either you have genetic problem, that your parents had heart disease or cancer or diabetes, whatever gave you the wrong gene, or you eating the wrong food, or you're under too much stress, you don't exercise, you don't sleep good, or you have too many chemicals in your life. So how can we convince the medical community that nutrition works? This started in Harvard Medical School. 1996, Harvard studied the human cell and find out something very interesting and very scary, that the chemicals that's coming in from the food and water and air and also self-induced chemicals, when you grow older you have your own chemicals, all of these, if you don't have enough antioxidants, enough bioflavonoids, the right kind of protein, the DNA right here, the gene right here, this is the DNA, it will mutate. Are you following me or not following me? You know what mutation means? Mutation means your cell, your gene, supposed to protect you against diabetes, but it's not. Against heart disease, and it's not. Against cancer, and it is not. That gene, something happened to it because either chemicals or radiation went inside, nobody checked it, nobody killed it, nobody removed it, and that cell happened to be your defense cells. The defense cells that you have this second in your skin, in your eye right now, in your nose, your lung, all of these things are exposed to the outside. They have to defend you against virus, bacteria, candida, parasites. They have to also remove chemicals, carbon dioxide, poisonous gases. They have to also rejuvenate the body itself. If the body have cancer cell, they kill it. These cells right here, they start producing the wrong defense. And those wrong defense, we able to measure them now since the year 2003, which is last year, until now, we discover them. We discovered the C-reactive protein is a protein that destroys all the blood vessels in the body, include the heart. It will eat it away. We discover homocysteine. That's amino acid that is poisonous to us. We discovered the LDL cholesterol, which we knew about it. We discovered things like tumor necrosis factor. That is a protein made especially against cancer. That is a protein that if I measure it on you, and your reading is supposed to be, let's say, below 20, you don't have any cancer in any part of your body. That's we discover that we can do tumor necrosis factor and predict who's going to have it, who does not going to have cancer. Are you following me or no? It doesn't tell you what is the cancer, but it tells you there is cancer developing in the body. We discover the other things like interleukin 1B and 6 and 8. They are things, all of these, supposed to be your friends, supposed to be, they work for you against cancer, they work for you against arthritis, against bee stings, against this, but something gone wrong. So what happens when they go wrong? They don't stop. So when you have a bee sting, then you have a reaction. When you have the pollen comes in, then you sneeze all over the place. Because the immune system doesn't know how to stop. You see somebody sneezing, somebody else is not sneezing. Are you following me or no? That means that person who have a disease, his immune system gone wrong someplace right here. Those are the proteins that we can measure and we can predict things ahead. Now, doctors, let's say pharmaceutical company knew about those proteins 20 years ago, but it was not published to us until a few years ago. Because when they discovered it, they would try to make a drug for it, and they couldn't make a drug for it. Then they published it. And we nutritionists grabbed it and said, wow, we can stop all of this with nutrition. We can lower the C-reactive protein, we can lower the homocysteine, we can lower the LDL, we can lower the cancer factor, we can lower all of this inflammation through nutrition or combination with nutrition and medication together. We can do it. But medically, they have failed. So these here, they cause inflammation inside the body, and I'm going to show you some pictures of those inflammations. You just be patient with me because I don't want to deviate from my goal. This picture right here, it tells me that this person brain have something wrong in the brain. Can you see? I don't know if you can see it from there or not, but we look at the brain, we see a black spots, right or wrong? Can you biopsy the brain easy and without damaging it? It's very difficult to biopsy the brain. Every time you cut it, you're going to cut million nerves. So we see it in autopsy. We see it only during brain surgery, but we can do nothing about it. Then during autopsy, we found out that these people have also in their skin before they died, spots. And the age spots, we start taking samples of it from live people. We look at it. We find out that it is cells. It is cells that it has been mutated. Let me look for a brown color here. This chemical that's produced inside the body, because that person does not have enough antioxidants, they keep accumulating inside the body. And when they accumulate inside the body, they cause brown spots in the skin, or they cause slime inside the brain. This slime inside the brain, it looks like this. That looks like that. So as you can see, there are problems already that cells are dying. Those big globules right there is the memory, that when you start losing memory, and every one of us, after the age of 25, start losing memory. Every one of us goes through stages. Gee, I don't remember that. I used to remember that. I don't remember this name. I used to remember that. We are afraid of Alzheimer. We are afraid of Parkinson. We are afraid of dementia. We seen our families in nursing home. We don't want to be like them, right or wrong? So we start running to the doctor. I said, do something about it. He said, there's nothing I can do. Then we looked at nutrition and we find the answer. This inflammation I just showed you, it happens inside the arteries. 99% of problems of inflammation happens in the circulation, in the blood that's swimming in your system. You have 1 million miles of arteries with blood in it that full of these chemicals attacking every place it goes to. Then you will have itchy skin, lupus, you will have memory problem, Alzheimer, you have cataract, you have macular degeneration here, you have a heart problems, you have a stomach problem, you have a cancer. All of these things because the free radicals, they select one area over the other. If we look at the arteries, some of you are new, we have shown you this is an artery of, if I can't find which side is up, which side is down, like he said. What did you say in your joke? Yeah, it's either up or down. So in any way, this is an autopsy of a baby that is 16 months old of the artery that starts showing sign of problems outside here and inside here. This means the mother delivered the baby with genetic defect. You follow me now? And that applies to all of us. Because none of us is exempt. We live in the same environment and we suffer from the same disease, the same problem, and if we don't take better care of ourselves, we will pay the price. We'll be either in a nursing home or we will be dead someplace. This is at 7 years old, and this is 18 years old, and we see a blockage, inflammation, swelling right here. You see it or no? I'm going to magnify it to you so you can see it more. And if we magnify it a little bit bigger, in this one right here, this is from a monkey that was given intentionally the stuff that makes him inflamed, and the artery start crystallizing right here, deposits of calcium deposits right there. And then it gets worse like that. That's from 22 years old male. And we can see the core of crystals developing here. I'm going to magnify the same one a little bit bigger. This one shows it right there. And then I'm just go through that very fast. Then you can see, I don't know if you can or not, crystals start forming inside, deposits start forming. You see the crystals or not? That's an artery is losing elasticity. Means if you strain yourself going to the bathroom, constipation, you can blow up your aorta. How many of us medical doctors heard that? That you're in emergency room, the ambulance called, so-and-so went to the bathroom, he has severe pain in the stomach, and he dropped on the floor. The diagnosis is ruptured abdominal aneurysm. Doesn't need another doctor. Once you hear that, immediately I call the cardiovascular team, get ready, and the patient will open up, we'll clean the blood, with hopefully we have the blood ready, and so him again. But you know, that's very rare chance he will live. This is the person we don't want you to be. This inflammation can start to look like this in this 24 years old boy, or sudden death. And yeah, it's a man, 24 years old, sudden death, right here. What did he die from? Suddenly, like this. We will see it in a minute. That's his also. And then let us skip through that and just go fast to his main problems. When we look at main problems, we find out that he had, you see the crystals very clear now in his arteries. That's 24 years old. And then we have another one, 34 years old, he died from something. And look at the crystals again. This is all inflammation now. Now we can do a blood test to detect this 10 years before this happened. And the blood test, again, covered by Medicare and insurance company if the doctor knows what he's ordering. Because if he doesn't know it, you don't have to worry about it. You can call our office. We can order it in your local hospital. They can do it. They send us the result. We call you with the result. That's how simple it can be. So this person, I just want to show you the end result, what it starts looking like. This is inside the artery, these crystals, and then just to magnify it a little bit bigger. Do you think that's healthy artery? And that's mine and yours. Because this person has an artery that's open, closed almost 90% like this, and suddenly he had the unfortunate blood clot. You see the blood clot in the middle right there. Then he dropped dead. So we don't want that. So what we're going to do? We try for years, try vitamins, nutrition, medicine, drugs. We can go nowhere, surgery. Then when we try nutrition, doctor says it doesn't work. You got to go with surgery. You got to go with drugs, but it doesn't work also. Now we find out that we can reverse it. This is the real arteries of the same people who died before, what it looks inside. The red coloring right here is all inflammation, the fire going on inside the artery. And that's another artery right here. You can see that, and this, another one right there. And then just to give you an idea, this is 33 years old, that completely inflamed. Then we have to find a way to make a diagnosis on our patients. We have to figure a way to look inside the body without waiting until autopsy. So here comes the newer technology, nuclear medicine scanners, which we have now in the United States. I have a nuclear scanner in my office that I did test to see if I have a beginning of blockage in my heart or not. And it says, no, your arteries are perfect. Then, a week later, I'm reading in a magazine that in Germany they developed a machine similar to mine, but better, that's 100 times more accurate than mine. And mine is state of the art. We paid $500,000 for it only a few years ago. And I called the company, can you give me a demonstration? Then they have a machine from Texas. They flew it to my office, and they said, we need a patient. I told them, I am a patient. I'll be your first patient. Then they injected the isotope, and I sat and all of this, and they, then the next day I have the result that I have beginning a blockage in my heart. 10% to 20% blockage is beginning. That nobody can see it. No angiogram going to see it. Nobody going to see it at all. Then I said, gosh, this is scary. But at least I caught it early. So then I start taking chelation. I start taking this. I start taking what I give to my patient, I do to myself. Then I find another machine that actually 3-dimension machine that it can look inside the chest without opening it. This is a live person right here in front of you with arteries going to each lung. With arteries going to each lung. You see that? You see, even we can see arteries in the heart itself. This even gets better than that. And insurance company and Medicare covers it also. This machine is covered. And these tests are expensive, but it's covered. And then we can even look at the heart itself. That is, the heart is working. Actually, I got my test done about a week ago or 10 days ago or something like that. I get my test done. I'm calling them. I said, you really have this machine in Chicago? He said, yeah. I said, oh, I like to check my heart. The doctor says, when do you want to come? I said, when can you give me an appointment? He said, right now. I said, right now I have patients. He said, tomorrow morning. I said, that's fine, I'll be there. Then I can believe it, and then I sat down and they give me the tour. And this is the artery right here, the main artery, you can see it coming. Do you know that your heart supplies only with very little arteries control your lifeline? This is the heart right here, and the heart will have the aorta, and one artery comes like here, and then when it comes, the left artery is the main one, it splits to two, one goes around, one comes down, and it splits to two, one goes diagonal, and one goes down. And if you have a blood clot here, you drop dead. If you have a blood clot here, you have a massive heart attack. If you have blood clot here, you have a minor heart attack. If you have one right here, you have very little heart attack. And you follow me or not? It's one single artery, small one, that this machine can see, that I showed you the picture right here. And not only this machine was able to do that, here is the same CAT scan looking inside the brain of a person finding aneurysm right there ready to rupture and has not ruptured yet. And that patient not only was saved, they had absolutely no damage to their brain because the doctor knew exactly where to go. Are you following me or not? There was no guessing at all. He knew exactly where to go and how to do it, either from inside or outside. Even it's been used right now to check for dentists, tell the dentists how far they can drill and where they can drill, where they cannot drill, and how much circulation the teeth is getting. So this technology we are blessed by in the United States of America and Germany and those countries. We have to use it for the nutrition people like you, and then you ask your doctor for it. And if you don't, if you have a problem in your brain or heart, and call us, we're willing to write a prescription for you and send it to your hospital if they have it there, and you get it done. This is just another one from a live person, that the machine just have the jaw. That's it. Nothing, everything was hiding, so the dentist can see exactly where he's going to do implant. So there's no mistakes, no rejection. This one coming right here is the lung, 3-dimension. It looks like this. And that's my lung. Okay, I was watching it when they were doing the test, and the heart is working, and the lung is working. I said, I'm shaking my head. They told me, don't shake your head. Okay. And it can see inside the kidney. That's another person. We can even see the circulation inside the kidney. We can see even kinks any place without opening people. I want to show you this. You're going to love that. This one right here, this one right here, internal carotid artery of the left side of a patient that had no idea that the artery, I want to show it to you right now because you got to see it. You're not a doctor, so you got to. Right here, the artery, internal carotid artery is closed, right there. You see that or no? So they were able to go in and bypass it, and the person didn't have any stroke or anything. So this is the kind of thing, but you see the circulation, how clear it is? You remember used to do the angiogram, the endoarterectomy, and how serious it is, and people have strokes. Now we don't have to even do that. Even the circle of Willis, I don't think you know what it is, but in the bottom of the brain, inside the brain itself, the brain sits over a lake of blood. Our brain sits over a lake of blood to prevent strokes. That irrigated by 4 main arteries. The vertebral artery and the internal carotid artery from both sides. And they all, when they go inside, they rush like almost about 30 miles an hour, blood, going like like that inside this area. Fantastic technology. And this machine was able to see aneurysm right here. You see right there the aneurysm, and the aneurysm was removed and the patient is alive. She had migraine headaches, and she was assumed that it's migraine, so everybody didn't think about it. This is actually, you can see the name of course you see my name right there, Mohamed Nasr right there. That's my chest, my lung, my chest sideways. And then it goes on more and more, but I want to get to the point, I want to get to it right away. Then, right here, where is this? Let me just find a name. Yeah, right in this direction. Here is the heart. You can see the heart right there, right? And this, you see the artery right here? This artery right here, that's my artery. And you see this spot right there, the white one? Yeah. It's a little deposit right there. Nobody will ever see that. Nobody. Not even my machine, the nuclear machine, saw that. 10%, and I can do something about it. That is blessing from God that we have this now. Look at Clinton. He did not have symptoms. He just had no symptoms, and he just had a feeling that he should be checked. There was no chest pain, there was no pressure, there was no short of breath. He's a junkie eater, it's true, but anyway, and 90% blockage in most of arteries. This is again the same thing as mine again right here, and anyway, it doesn't matter the name upside down. You see the artery, and then, but I'm going to show you the picture in color so you don't go to sleep. Okay, right here, if you want to see, this is my arterial tree in my heart. That's the whole thing right there in front of you. That's the left coronary artery. That's the circumference. That is the left anterior descending right here, and then the anterior branch right there, and we see a plaque here, there, and there, and there, and those has to be removed somehow. You see that? So you see the name and you see everything, so you don't have to say, well, that's not true. That is true because that's mine, and that's what you see in front of you in color again, and it's magnified in different versions. It can be bigger and smaller. And in any way, that's the end of that. So these pictures I just showed you right now indicating there is something wrong in the circulation. There's inflammation someplace. And I must do something about it. So when I looked to the causes of inflammation, we find out it is really very simple, the causes of those inflammation. Either it has to be nutritional problem, or genetic problem, or a stress problem, or chemical problem. Are you following me or no? Then what did I do about it? I discovered, 1996, that when I did my PhD in 1967, we discovered there's something called bioflavonoids that if it goes inside the body, it can help it. By 1996, Harvard Medical School discovered 4,000 bioflavonoids inside the cell itself in the nucleus. The nucleus of the cell itself has 4,000 bioflavonoids inside it. Can anybody tell me why we have so much bioflavonoid inside the nucleus around the DNA? Around the DNA, why do we have? There was no vitamin C, there was no vitamin E, there was no vitamin B, there was flavonoids. The answer to that, Harvard went further to say that when they give the patients who have no flavonoids, they give them lots of flavonoids, their gene, the DNA gene that is making those inflammation protein, you remember I talked about? The tumor necrosis factor alpha and beta and all of these things, they went down. When they give them the flavonoid, it went down. It went down because the DNA that is mutated, that you've seen it early in the beginning of the lecture, is able to repair itself. So how do you like that? How do you like that? You have a diabetes, and your father had diabetes, your mother had diabetes, and you got married and you worry about your son for multiple sclerosis diabetes, and you say, I'm going to take care of myself, and you do take care of yourself, and the baby born without diabetes. And that's what Harvard found out. That genetic problems can be reversed. You understand or no? So the inflammation, it's serious, it matters inside the body. And I showed you the arteries. These inflammations, what do they do? Here is what they do, and let me see the watch. We've been talking for 1 hour only. That's good. It feels like 3 hours. Inside the artery, because it's 1 million miles, it is so lubricated. Just some of you imagine if you are an engineer. Some of you imagine if you are an engineer. And I ask you to make a pump that pumps about 5 ounces of blood, thick blood, every beat, and it does it 80 times per minute. So it does it so many times per hour, so many times per day, and it goes for 1 million miles and come back. 1 million miles and come back every 20 minutes. What kind of resistance you supposed to give me in front of me? Low or high? Low, right? If there is a resistance, it's not going to come back. Are you following me or no? That is our problem. Our problem is circulation. Once this is inside the artery, and those cells right here, let me see if I have another slide. This is inside the artery right here, and those cells holding hands like this. And they relax and go like this. They call the pulse, like that. But they'll let go. There is no single red blood cell can penetrate between those cells. No single blood clot can go between those cells. No single virus can go between those cells. No single white blood cell, pus, can go between those cells. Are you following me? It doesn't matter what disease you have, those stays intact like this until something happens. What happened? There is something disturbed the flow. There is inflammation. Inflammatory cytokinins. This cytokinins is those proteins I was telling you about. This being ignored completely in medicine right now. There's nobody try to lower the cytokinins. Even Medicare pays for it, but nobody's doing it. I called my lab. I told them I want to do it. I said, What's that? It's been published in the literature, and they didn't know about it. So now they know about it because I want it. Now they made a test for me that I can order. And then when we called Medicare, he said, what is that? I told him, it's some kind of protein. Tell us. He said, oh, we cover it then. I said, do you know what I'm talking about? He said, no, but we cover it. Okay, that is the problem with insurance companies. They're so stupid, they hire somebody who doesn't know anything about medicine, some kind of retired person, and they telling the specialist, like the neurologist that's quitting his practice, what he should do, what should not do, what should be covered, what should not covered. This is not right. Those specialists in the insurance company should be professors, should be liable to say this thing. Do you know HMO, you cannot sue? You know that the Congress passed a law that neither Democrat or Republican, neither of them, want to cancel that law until today, that HMO is immune from any lawsuits, even if they make mistakes. Did you know that? Congress passes with majority for both sides. So everybody's getting paid, not only one side. Because we, doctors, tried very, very hard to have it reversed. We could not have it reversed. The lawyers, they tried to have it reversed. They could not get it reversed. Money talks. So what happened? HMO patient, once they have HMO, I tell them, well, you just wait until you die. They're not going to do anything until you drop dead. That's what's going to be the policy. So this cell and this cell, you see, they are connected. But all of a sudden, there is a protein right here, comes in and causes fire in this area, and the cell swells up, and they start going apart. This inflammation right here is the problem. Lipoprotein, we know about cholesterol. That's we know about. But did you know that the cytokinins I mentioned to you before, each one of them is like crazy glue, is over many, many times causes more blockage than cholesterol. But because there is no drug against them, then nobody talks about them. For example, anyway, I just want to remove that after you understand. Once this separates from each other, there is increased permeability, and there is trapping of cholesterol, and then there is impaired vasorelaxation, or you will have a spasm in the artery, and then you have increased leukocyte, means that the pus will start coming, the white blood cells will start coming to the area. Then they start migrating inside the wall of the artery and separating it and make crystals later on. That's what you saw in the beginning. This is how the diseases that we have aging is developing. This is the reason it's developing. And we have many, many diseases that cause this endothelial dysfunction, ED. ED means endothelial dysfunction. The endothelial dysfunction is what causes aging. Most of aging is caused by that. There is something wrong in your circulation, either by age, heart failure, diabetes, cholesterol, lipids, smoking, immune problem, estrogen deficiency, atherosclerosis, blood clots, inflammation, like I mentioned before, peripheral artery disease, like your hands gets cold in the winter, reperfusion injury, all kind of things like that can cause circulation problem, and aging will start. So to summarize it to you, the endothelium, to stay healthy, it needs more dilatation, not constriction. It needs growth inhibition, means the artery will not allow itself to be a tumor. It will not allow itself to swell up, not growth promotion. Growth promotion, that's what cancer does. Cancer cells are so tricky that they have managed to fool the whole body and to tell the body, I am really innocent, I'm a good cell, send me more blood. and the body sends tons of blood to it and it multiplies all over the place. And it is also from inflammation. We need antithrombotic, like vitamin E. Some people tell me, I've taken alfalfa and calcium and I'm on Coumadin. I couldn't take alfalfa because I'm on Coumadin. That's not true. Alfalfa has nothing to do with Coumadin. If you don't eat alfalfa, you have vitamin K still in vegetables and salads and anything you sprout, you eat, you're gonna have vitamin K in it. And you think vitamin K is gonna block Coumadin, rat poison? There's no way anything can block Coumadin. You follow me or no? So it's a joke telling patients right now that take a blood thinner, don't take this, don't take this, don't take that, because your body right now, 1 million miles of arteries, do you know that you have blood clots right now when you're sitting? You have blood clots, but they dissolve all the time. You have a blood clot right now in your leg, and it's dissolved. And about 2 seconds later, it's dissolved. Before even it goes 2 inches, it's dissolved by itself. Because we have antithrombotic, vitamin E is there to do that. We don't want prothrombotic. Are you following this medical terminology or you lost? Okay. We have to have anti-inflammatory inside our body. The best anti-inflammatory you have in chocolate product is alfalfa. The second best anti-inflammatory is calcium and magnesium and zinc. And the third best one, which is the latest, is pain relief complex. Because pain relief complex is the only natural, actually there's no synthetic, there's the only drug, let me call pain relief complex a drug now, because I have the right to call it a drug, there is no other drugs, and it stops arthritis. Because it inhibits lipoxygenase, which is the enzyme that causes arthritis, or causes inflammation, LOX inhibitor. LOX5 inhibitor, lipoxygenase inhibitor, it's there in nature. But the reason we didn't know about it, because there was no drug made for it. So after so many years, the research became public, they knew about it 20 years later. That Shaklee just came out with the pain relief complex last year, right? Because we didn't know that Boswellia plant in India and Pakistan and China, in this area in the Himalaya, have tons of and in the United States even have tons of anti-arthritis natural medicine. But if the university doesn't tell us, or the drug company, we don't know. Now we have it, that we have anti-inflammatory. So if you want anti-inflammatory, anti-aging, take some alfalfa, take some calcium, take pain relief complex. You don't have to follow the recommendation of the company and take 6 or 7 or 8. Maybe your budget doesn't allow it. If your budget doesn't allow, take 1. You know, some people tell me, I can afford this. I say, take 1 of each. Are you following me or no? And says, well, it doesn't taste good. Since when anything good tastes good? Everything good tastes bad. So in any case, I told them, disease is worse. But you got to convince yourself to take nutrition. You got to think of yourself as number 1, and everybody in your life is number 2. Everything in your life after God is you. If you don't take care of number 1, you are no good for anybody else. And this is why we spoke on inflammation, that you have to take anti-inflammatory. If you want to take aspirin as an anti-inflammatory, go ahead. If you want to take ibuprofen, anti-inflammatory, go ahead. But before you do that, give your body a chance with the alfalfa and the calcium and the others before you jump and take an ibuprofen and naproxen and all this stuff. Are you following me or no? Do that and see. But don't go to the person who sold you the vitamin and tell him, yeah, I've been taking it for a month and nothing happened. Yeah, but you have 5 million diseases too in your body besides the inflammation. So those vitamins are lost. What to do first? And somebody will say, but I feel good. Well, you know, lots of people feel good, drop dead. And somebody say, well, I run. Lots of people, runners, Olympic runners, drop dead, like Floyd. She was the Olympic champion in Korea, I believe. Was in Korea or Japan? I don't remember. Remember Floyd, the girl who 5 gold medals or something in running? She had those pretty nails with all pictures on, and she goes like this, you know, in front of the camera. You're too young for that? Okay, it was only 8 years ago. And anyway, she dropped dead from something happened to her heart. Somebody will say, I'm too young, it's too expensive. This is the joke. Expensive after you see plaques in your heart like me. My vitamin jumped from 6, I used to take 30 vitamins a day. Then when I got older and my prostate bothered me, I said, it's cancer. Then I went to 67. Then now I went to 72, and now after this, up to 90. Gosh, it makes you nauseous when you take the stuff. You know, I look at it, I hate it. When I get to my bag, I said, okay, you just think about anything else. Then I get the water and I look outside the window and all of that and keep going and going until, because the first time I had that mini, I took it, I went up and hit the window. They all came out, you know. And so if somebody tell you, you know, it bothered me, understand why. Because we don't like to take pills. But if you calculate all the 90 vitamins in your hand to McDonald's hamburger, 1-to-1, they'd be smaller than a hamburger. Right or wrong? But the hamburger tastes better. These vitamins don't taste better. So why do I take them? Because as a doctor, I know I could be slowly dying if I don't do something. Slowly dying means those blood tests I'm talking about start rising, and I got to block it somehow. Just like you saw the calcium. There's no other test showed me that except that new machine. It's called 3D CAT scan. So also, you must have enough antioxidant, not pro-oxidant. So you want to make it higher right here. Can you see it, everybody, or what? Right here it is. Yeah, we want more antioxidant, not more pro-oxidant. The more you have of constriction, growth promotion, pro-thrombotic, pro-inflammatory, pro-oxidant, you're going to die. This is death, this is inflammation, this is aging, and it is reversible. So I have so many other things here to talk about, but I'm going to be choosy what I want to talk about now. Now, you notice today I didn't pass any information to you. I always do. Because after I send my assistant to the Office Depot, whatever Office Max, and she made I find out that you have to read about, 15, 16 pages of things you don't know. So after I made all the copies, I left them. I said, no, I'm not. I left them in the car. I said, no, I'm not going to give it to anybody because you wouldn't know what I'm talking about anyway. So we have a disease called atrial fibrillation, that the heart goes fast. You heard about it, right? Fatty acids like EPA and GLA, omega-3, can reverse that. You said EPA in earlier. That's true. EPA is a very good anti-inflammatory also. The homocysteine, this is going to be all in the video. So, if you want to take it, you're gonna take the video and pause it and read it. And also the next lecture and the one after that, I'm going to compile all the pages for you in the last lecture, which are going to be maybe 2 or 3 lectures. And then I will have them in the front there, and you will be paying for them $5, and the money will go toward the room rent and things like that we enjoy tonight. Okay, that's what we're going to do. So we're not going to pass anything for free anymore. I'm not going to get the money. I just want you to pay for it so we can have more lectures. So the homocysteine rises. It makes the bone have osteoporosis. anti-inflammatory, like the Shackley anti-arthritis medicine, can be anti-cancer. So that pain relief complex, if I have cancer, and I know cancer causes inflammation, I'd be taking 30 alpha-alpha, I'd be taking 6 of those if I have cancer, because I have inflammation. This is just some stuff I pick here and there. There is so many scientific proof I have for you, because I told you, I promise you're going to see scientific proofs. Then I better tell you something about scientific stuff before I finish. This is here saying, in summary, that diet, the GLA, and it can inhibit prostaglandin E2, but increases prostaglandin E1 and 3, which is a good one. But because E2 is bad for us, it blocks it. So GLA is also anti-inflammatory. We didn't even talk about that. We talked about alpha-alpha and all of that. But you see, this is why I said take one of each, because you don't know which one's going to help you. I have to put this on here to, I want you to see that. For many, many years, I've been telling people stress test is inaccurate. When you tell somebody, I want to see if you have blocked arteries, he said, my blood pressure is good. Well, your blood pressure is taken when you're sitting in the doctor's chair. Your blood pressure has to be done when your heart rate is 90% of maximum. So when you go to the health club and you know your heart rate is 170, take the blood pressure at 170 and see what it is. If it is the lower number, over 90, that's dangerous. Over 100 is very dangerous. Over the 110, extremely dangerous. You follow me or no? Over 120, it will ready to rupture, 130 ruptured, blow up in the brain usually. So stress test is very inaccurate. I wanted to show you also before I forget, I want to bring something here. There was something here and I cannot find it. Okay, I don't think I made a copy when I went to the place anyway. One of the things that we look for, if we look for if you look at the diet that we had, the Adam and Eve sons were eating, they were consuming that much potassium every day. And that's how much potassium we consume now. See the difference between one diet and another diet. They were consuming very little salt. We consume lots of salt. They were consuming lots of fibers, over 100 grams a day. We consume less than 9 grams a day. They were consuming 37% protein, soy protein. Soy similar protein. We consume about 20%, include hamburger, include McDonald's. They consume 41 carbohydrate. It's the same, but it's different. They were eating more bread and grains. We eat more sugar. The fat, they were eating more oil, 22%. We have 40% saturated fats in margarine and that. So with this type of diet, you'll be healthy. This type of diet is not healthy. I also wanted to mention to you, this was actually the topic of the lecture when I was writing it, and you can see, the doctor, he came to me today, I was sitting to the neurologist, he said, I'm going to tell you a joke, that this doctor went skiing, he took the ski, and then he got stuck in the mountain someplace in the snow, and he wanted to use the snowboard to the helicopter to help him when they're looking, and they couldn't read the writing. So he died. So he saw me writing, so he told me the joke. So I told him, well, that's the way it is. In any way, Dr. McKinley of Harvard Medical School, he is the one who discovered homocysteine. What is homocysteine? Homocysteine is a protein. It's an amino acid you eat with food every day called cysteine. And that amino acid supposed to make muscles for you. Rather than making muscles, two amino acids connected with each other to cysteine and made homocysteine. Homo means same sex. Homocysteine. And homocysteine became a toxic agent to the body, and it is over 100 times more dangerous than cholesterol or triglyceride. Clogs more arteries. So the physician must do homocysteine level. And homocysteine level must be done when you're fasting, and also it's better if you lay on your back and they take the blood and they refrigerate it right away, and then any reading over 5 is dangerous. This doctor here, when he discovered the theory of homocysteine, he lost his position at Harvard after he taught there for 25 years. He lost his position. Then he went to work for another hospital. I don't have it right here, Providence. The VA Medical Center close by. He went to work for them. Then 10 years later, another doctor came, discovered homocysteine, and got the credit for it. And this guy, who was the father of homocysteine, got no credit at all for it. So he discovered it, but 1992 it was discovered by somebody else. And then 1995, the doctors of America decided that 4,000 patients should be checked, and they find out all the 4,000 patients had blocked arteries when they have homocysteine. And if we look at what causes aging from homocysteine, we find out that we can prevent the inflammation in strokes using nutrients, and Framingham study have proven that in Massachusetts. High blood pressure, we can actually give nutrients for high blood pressure rather than give drugs, or we can make combination. Dementia and Alzheimer, New England Journal of Medicine discovered that nutrients can decrease the inflammation of Alzheimer patients and reverse their memory. Diabetes, we have many diabetic patients that come to us with blood sugar so high. Once they go on the right diet, blood sugar comes down to normal, like your friend you told me about. And cancer also was found to be reversed using nutrition. Blood clots in the legs was found to be reversed using nutrition. This is, by the way, in front of you, all the research has been published for that when we block those inflammatory proteins, that's what we got. We found. So if you have a doctor and you have a disease, you tell him, I want to do the inflammatory proteins. And if you don't know what they are, ask him if he doesn't call us. And I tell you about what's their name. Because the reason we have this inflammation is because the human cell itself, it got mutated. And without taking flavonoids, then you're not going to be able to correct or reverse the problem. The Shackley came out with the Flavomax recently, and that's an excellent addition to medicine. And this product will help to reverse some of the inflammation. Not by itself. You got the garlic does it, the arthritis relief complex does it, alfalfa does it, EPA does it, GLA does it. So you have to take most of the nutrients. I'm going to show you this. Oh, I found the article I was looking for, by the way. Here is this that I saw in a newspaper from Milwaukee about a few weeks ago. that they studied the mother milk in America, and they find 100% of mother milk have fire retardant, PCP. So you have to ask yourself, how did it get there? You didn't put it, I didn't put it. Who put it? Industry. The industry, they have connections in the Congress. They probably passed a law that everything should be sprayed with fire retardant without thinking that causes cancer. So is this 100% is dangerous or no? That's you and me and our children, grandchildren, right? We have to have antioxidant to counter it. We can cry about it. You can take vitamin C, vitamin E, vitamin B. They all can take it out of the body, or we can do even chelation to take it out of the system. But the homocysteine level, this is a curve that's been published that your homocysteine must be in this range. This homocysteine right here is 5. You see that? Your chances of having inflammation is 0. You got that? Okay, when it goes to 10, your chances is 200%. Not 2, it's double. You follow me? It's a multi-factor system. When it goes to 15, it goes to 400%, until you get 1200% up here. So it is important that we do the blood test and lower it nutritionally. There's nothing can lower it except, the only thing can lower homocysteine is B complex, and which has folic acid, and vitamin B12, and vitamin B6, which is in the B12, the B complex, I'm sorry. And there is a substance called trimethylglycine. It's an amino acid that we have. Shaklee doesn't have it yet. They will in the future, that it has the ability to donate methyl atom. The process, we call it methylation of the homocysteine. What is methylation? Methylation is like chelation. Methylation basically, I will methylation is basically, we take the homocysteine amino acid here with amino acids connected, giving you this toxic substance, and donate methyl atom to each one of them, and convert it back to cysteine again like it was before, or convert it to methionine, which is a good amino acid. But we don't want homocysteine. Homocysteine is a toxic vitamin. Homocysteine is a toxic amino acid that present in everyone, and we must remove that. That's one of the inflammatory agents. That's number 1 on the top of the list, right here. And they have, here's Dr. McCauley, they're talking about him right here, that he done all the work and he lost his position. I didn't know it was there. But in any way, if we want to do methylation to it, to correct the DNA, you must take the Flavimax with the B complex, and you might have to need to take B12 extra so you can reverse the homocysteine. And this was actually published in JAMA right here, that vitamin B12 and B complex, they can reverse. They can dissolve it, actually. If what I got is homocysteine, which probably is, then I increase my B12. Start taking chelation therapy for myself, like once a week I'm going to take one. And then in 6 months I repeat the test. If it got worse, then I have to take another factor. Maybe I have to take 200 vitamins rather than 100. Who knows? I hope not. Okay. I just want to a summary right here in this article. This is going to be one of the pages you're going to get in the future. Is basically the summary was anti-inflammation is the answer to control aging. And in this article right here, it talks about that we do have too many of them: tumor necrosis factor alpha, interleukin 6, interleukin 1 beta, and also interleukin 1, I don't know where it is, but supposed to be there. And then we have also here C-reactive protein, right here, CRP down there. And then we go right here to when cytokine blood profile is conducted in these people, we usually find excess level of one or more of these things. Scientists have identified dietary supplements and prescription drugs that can reverse that. One of them is EPA. DHA is EPA right here. And that can inhibit the fish oil. EPA can inhibit tumor necrosis factor alpha and interleukin 6 and interleukin 1 beta and interleukin beta right here. There is 13 studies being done to prove that DHA does help, GLA help, vitamin K alpha helps, antioxidant help, vitamin E helps. C-reactive protein right here is being studied that also vitamins can help. It was published in New England Journal of Medicine. With the availability of blood testing, we are in good shape right now. Then, what's that? For those suffering from multiple degenerative changes, get the blood test done. Even there are phone numbers we can refer you that you can get the blood test done. So this is the scientific proofs I was telling you about in the title of the lecture, that we have a scientific proof that we can reverse aging or slow it down or at least improve on it. Let me see if anything else I want to talk about. No, that's it. I think I'm going to stop right here. And I'm going to give you my phone numbers right here. Oh, it's already pre-written for me. My cellular phone number is right there, 847-571-3914. And the office is 847-356-9009. And why come I have two of those? This is supposed to be H. Home, I think I need to take all of those new things. Actually have the memory optimizer then. 847-295-0634. This is the and these are the diseases that we have proofs that nutrition will help. Heart attacks, Alzheimer, congestive heart failure, strokes, arthritis, aortic valve stenosis, kidney failure, lupus, asthma, psoriasis, pancreatitis, allergy, fibrosis, surgical complication, anemia, and fibromyalgia. And there was more, but I didn't have a chance to copy it. So all of these things, it's caused by inflammatory cytokines. Right here it is. Cancer, chronic inflammation causes cancer. Chronic inflammation contributes to arthritis, and so on. So you don't need more proof than that you must start taking food supplements. You must start looking at your health in a different way, and then start looking at your body and say, well, I'm going to do something about it. What you're going to do about it? Number one, medically speaking, see what problem do you have first. Do the homocysteine level. Do all these factors. Do the heart test. Do the stress test. Do the cardiolite. Don't just do thallium or just a stress test. Do a cardiolite stress test. You're entitled to it. And if the doctor doesn't do it, you tell him about it. I want to have it done. Non-invasive stuff for the heart. You might like to check the kidney and the lung for cancer, for anything like that you don't know anything about. And once you have those done, then you know what type of protein, carbohydrate, and fat, and vitamins, and water, and mineral, and fiber you take. And then stress right here. Stress, most of the stress is self-induced. What do I mean by self-induced? you allow the stressful factor from outside to get you. Because if you block it or find a different friend who doesn't cause stress, then you're fine. But if somebody give you stress, says, do you know they had an earthquake in California? Tell them, oh, good. So they can realize God exists. So they stop being homosexual, maybe. Then, if they say, they had tornado in Florida, I say, oh, good. Maybe they realize God is more powerful. I'm going to answer it that way. Because, you know, I know it's bad, but I don't want to be sad about it. If they need donation, I give them donation. But I need to hear something beautiful that we have in our nature, like Green Bay Packers win the first game, lose the second game, something like that, you know, which I was shocked anyway. But I must be the only one from Chicago who doesn't like Chicago Bears. But, but anyway, that's sad part of the year anyway. Maybe it will never happen again. But the stress control is something from outside you allow to happen. If you take enough vitamin C, enough calcium, have enough sleep at night, 8 to 9 hours sleep, and all of that, your body have a chance to regenerate. We all are stressed. Everybody has something bother them. Nobody's perfect. Are you following me or not? We can't run away from everything, but you can do something about it. Exercise is good. Prayers are good. Sleep is good. Finding the different friends are good. You know, all these things are factors.